Today, we will be discussing a literature review about the clinical characteristics and outcomes of COVID-19 in patients with type 2 diabetes mellitus, specifically in Turkey. This literature review analyzed the different characteristics, one of them being age, and how they affect the mortality of patients diagnosed with COVID-19, while also taking into consideration their previous diagnosis of type 2 diabetes. Hello, my name is NINIVE Reyes, and I am a student in the Master's in Physiology program here at State. The authors in this literature review include Alper Somnes, Ibrahim Demirci, Sem Haimana, and the listed authors in this slide. Type 2 diabetes mellitus affects a significant amount of the Turkish population, not to mention the global population. With the diagnosis and progression of type 2 diabetes, come many other health factors that can further complicate a patient's morbidity, including high cholesterol, sarcopenia, obesity, hypertension, and heart disease. Type 2 diabetes also increases the prevalence of obesity. In patients who are obese, we see an impaired respiratory function, higher risk of thrombosis, and an increase in insulin resistance, as well as impaired glycemic regulation, all of which affect a positive outcome when being exposed to a virus such as COVID-19. In recent years, we have seen the rise and fall of cases related to COVID-19. Mortality rates in the US as well as globally seem to follow a trend as discussed in this article. The risk of infection for older adults is higher compared to that of other populations due to their compromised immune system. According to this article, researchers saw a more severe course in patients with type 2 diabetes when it came to COVID-19. Patients with type 2 diabetes were at an increased risk of mortality, longer hospital stays, and an ICU admission. This study sought to find how age, gender, smoking habits, and BMI affect the mortality of these patients. At this point, it is important to mention how this study discussed the implications of whether or not a patient suffered from pulmonary illnesses. As mentioned, type 2 diabetes brings many comorbidities, among them pulmonary illnesses due to obesity, among other factors. With the addition of pulmonary illnesses come further complications due to the development of pneumonia, bronchitis, and tuberculosis. Focusing on nutrition, a good management of type 2 diabetes, and a healthy BMI help to increase chances of survival. The author's goals for this paper were to investigate the clinical characteristics of people with type 2 diabetes mellitus hospitalized for COVID-19 and to analyze potential factors associated with adverse study outcomes among patients with type 2 diabetes mellitus. So, how were the study participants selected? Data was collected through the Turkish Ministry of Health National Electronic Database for overall population demographics. Health information was obtained through the Turkish Ministry of Health Laboratory Database. Remember, the sample patients used for this particular literature review are based out of the population of diseased type 2 diabetes mellitus patients in Turkey who are hospitalized with COVID-19. The population used for this research is representative of all of the Turkish population due to its large sample size and utilization of the only database of insurance coverage for 95% of the country. If we take a close look at this flowchart, we can see that the total number of subjects started at around 150,000. From there, these subjects were further selected based on hospitalization. These hospitalized patients were then divided into two groups where type 2 diabetes patients were matched with patients without type 2 diabetes based on age and gender. By creating equal subject groups, they were able to obtain the study population of 18,426 patients. Data was analyzed by comparing the outcome of patients with type 2 diabetes versus patients without type 2 diabetes, both diagnosed with COVID-19. Using multivariable model, researchers found that age, male gender, positive CT findings of COVID-19, lymphopenia, obesity, and the use of insulin-based regimens were significantly associated with mortality. In this table, we can see the comparison of different characteristics between patients with and without type 2 diabetes hospitalized with COVID-19. Type 2 diabetes patients were associated with a higher BMI, longer hospital stay, and ICU stay of 8 and 6 days, respectively. Intubation and death were also significantly higher in these patients. The prevalence of hypertension, dyslipidemia, obesity, COPD, heart failure, CKD, and cancer were also more prevalent in these patients. Another important factor to note was also the unmanaged glucose levels upon admission to the hospital. This may also explain the poor outcomes seen in these patients. Due to social distancing, the pandemic led to a reduced amount of physical activity, consequently leading to a more sedentary lifestyle. This was associated with a deterioration in glycemic control. All these factors contributed to the higher mortality rates. In this course, we have discussed how different scales and screenings can help us understand a patient's overall health. In this research article, authors obtained the age, gender, BMI, hemoglobin A1C, and other previous underlying health issues to categorize and understand how and why COVID-19 affected said patients. Hemoglobin A1C levels higher than 6.5 indicate diabetes mellitus. Properly managing blood glucose levels can help prevent complications and maintain a healthy lifestyle. Older adults are more susceptible to contracting illness due to low lymphocyte production, as well as their compromised immune systems. Vulnerability of older adults to COVID has been linked to inflammatory cytokine production and decreased innate and adaptive immune responses. All of these different factors make older adults more susceptible to COVID-19 and may result in a poor outcome. Due to social distancing, the pandemic led to a reduced amount of physical activity, consequently leading to a more sedentary lifestyle. Being active can help improve sarcopenia and aid in glycemic and metabolic control in older adults with diabetes. Although this literature review was intended to be a quick overview on how type 2 diabetes affects patients diagnosed with COVID-19, for further expansion on this data, it would be considered to discuss how and why all of the factors mentioned, such as age, BMI, gender, affect the mortality rate of COVID-19. Another limitation seen in this literature review may be the fact that only hospitalized patients were used as their pool of research. Including more patients in the research could also help further understand how other underlying nutritional factors affect a patient's outcome. Lastly, it would be fair to discuss how the type 2 diabetes patients were managing their diabetes before the diagnosis of COVID-19. For example, were they taking their medication? Were they watching their diet? How was their physical exercise, etc.? This concludes my presentation. Make sure to leave any questions you may have about this content here.